Hi everyone. Now let's start discussing about a new topic, that's the respiratory system, starting from its anatomy. So in respiratory system we will mainly focus on very important parts. I mean very important things in anatomy, like regarding the pleura and the lung borders. So the first one I'm going to discuss is regarding the pleura. So as you can see here on the screen, pleura is the outermost covering of the lungs. So this is having two layers. One is called as parietal pleura, which is the outermost layer, and the visceral pleura, which is the inner layer. Between these two layers are related to, or these two layers, the embryological relation of these two layers, usually the pleura, pericardium, and the peritoneum, all these coverings of lungs, heart, and the GIT or the intestines are derived from the lateral plate mesoderm's two layers embryologically. Those are the somatopleuric layer and splanchnopleurotic layer of the lateral plate mesoderm. So similarly here, the parietal pleura is derived from the somatopleuric layer, which is a somatic layer, otherwise called a somatic pleura. The visceral layer is derived from the splanchnopleurotic layer of mesoderm of lateral plate mesoderm. This is the embryological correlation over here. Next, so in between these two layers of pleura, the parietal layer and the visceral layer of the pleura, there is a cavity called as pleural cavity. So this cavity has a fluid called as pleural fluid. So the clinical term called as pleural effusion means there is increase in the amount of pleural fluid, resulting in there is no space for lung to expand, resulting in breathing difficulties. Yeah. So another anatomical aspects over here, the pleura, based on its relations on different dimensions, or based on its relations surrounding, it is divided into various categories. The apical most part of pleura is called as cervical pleura, number one. Next, the mediastinal region, the pleura which is related to the mediastinum, between the two lungs there is a space called as mediastinum, where the heart and many other structures like major vessels like superior vena cava, esophagus, and even arch of aorta, all these things are present in this space called as mediastinum. Therefore the pleural surface of the lungs which is related to the mediastinal cavity is called as mediastinal pleura, number two. Number three, the lower surface of the pleura, the lower or the inferior surface of the pleura which is related to the diaphragm downwards is called as diaphragmatic pleura, and the remaining pleura which is related to the ribs, the remaining pleura anteroposteriorly which is related to the ribs is called as costal pleura. So these are the various divisions of the pleura. So there is cervical pleura, mediastinal pleura, diaphragmatic pleura, and costal pleura. Yeah, regarding the nerve supply of pleura, there are two layers, right? So the parietal pleura is supplied by the somatic nervous system, and the visceral pleura is supplied by autonomous nervous system, that is a sympathetic and parasympathetic nervous system, which supplies the major viscera also. Yeah. So the parietal pleura, the somatic nerves, two important nerves are important over here. That is the costal pleura and the peripheral diaphragmatic pleura is supplied by the intercostal nerves. Very easy, since the costal pleura is lying just below the intercostal spaces. Therefore, the peripheral diaphragmatic pleura and the costal pleura, the peripheral diaphragmatic pleura and the costal pleura of the lungs is supplied by intercostal nerves. Number two, the central diaphragmatic region, the central diaphragmatic pleura and the mediastinal pleura or the medial border or the medial surface of these lungs, that is mediastinal pleura, are supplied by the phrenic nerve which runs along the mediastinum itself. So phrenic nerve, yeah. So the main important anatomical concept is the heart. From the right border of the heart is related to right phrenic nerve, and the left border of the heart is related to left phrenic nerve. So that way we can remember this phrenic nerve supplies diaphragm, number one, and also supplies us this pleura and this pleura, that is the mediastinal pleura. This is the mediastinal pleura and the central diaphragmatic pleura. Yeah. But whereas the peripheral diaphragmatic pleura and the costal pleura, all this costal pleura, it is supplied by intercostal nerves. Yeah, this is about the nerve supply of pleura. A small a small anatomical concept called as suprapleural membrane or Sibsons fascia is also another important anatomical relation over here. So what is this Sibsons fascia? So there is a group of muscles called as scalene group of muscles. There is a group of muscles called as scalene group of muscles arising from the transverse process of the vertebra, usually the cervical vertebra. So arising from the transverse process of vertebra towards the medial border of the ribs, medial border of the first rib especially. So these group of muscles are called as scalene group of muscle. Among them, the scalene medius muscle, the remnant part is modified to form a fascia or a membranous structure called as Sibsons fascia. So what is the anatomical position of this fascia is it is attached between the transverse process of C7 vertebra. So this is the transverse process of the C7 vertebra and this is spinous process. So from the transverse process of C7 vertebra towards the medial border of the first rib. So this between the seventh cervical rib transverse process and the first rib's medial border. So this is the attachment of this fascia called as Sibsons fascia or suprapleural membrane. Yeah. So relations, if we talk about the relations, inferiorly there is cervical pleura. Just because it's a suprapleural membrane, it is just above the cervical pleura. That is the apical pleura. Next, superiorly above this fascia, we have the neurovascular bundle. Which neurovascular bundle? Just above the first rib, we have clavicle. Therefore, below clavicle, there runs the important vascular structures subclavian vein and subclavian artery along with brachial plexus. So, subclavian vein and subclavian artery along with brachial plexus, mainly the subclavian vein and subclavian artery, forms a superior relation to this suprapleural membrane or Sibsons fascia.